Currently, diabetes is treated with numerous drugs from different pharmacological groups, and many of them have unwanted side effects. The main disadvantages of insulin therapy are hypoglycemia, the formation of antibodies to exogenous insulin, and insulin resistance. Frequent use of sulfonylurea derivatives can lead to depletion of pancreatic beta cell resources and the development of hypoglycemia. In addition, they can cause toxic allergic reactions, damage to the kidneys, liver, blood and blood vessels, and dyspeptic reactions, nausea, vomiting, constipation. Metformin from the biguanide class is contraindicated in ketoacidosis and severe symptoms of diseases with concomitant tissue hypoxia such as heart failure, respiratory failure, myocardial infarction. Inhibitors of alpha-glucosidase are poorly tolerated. Moreover, taking these drugs 3 times is not convenient for patients. There are also other groups of anti-diabetic drugs: glucagon-like peptide 1 inhibitors, sodium glucose cotransporter 2 inhibitors, thiazolidinediones, peptidase 4 inhibitors. In any case, any medication should be prescribed by your doctor, take into account the individual characteristics and the course of the disease. But before you plunge into this pharmacological ocean, discuss with your doctor the use of alternative medicines such as vanadium and chromium. Currently, these are potential agents that will reduce insulin resistance without increasing the insulin dose in type 1 diabetes, increase tissue sensitivity to insulin, and enhance its effects in type 2 diabetes. Now I'll tell you about this in more detail. Chromium. Chromium is an essential nutrient involved in normal carbohydrate and lipid metabolism. Chromium is used for improving blood sugar control in people with prediabetes, type 1 and type 2 diabetes, and high blood sugar due to taking steroids and HIV treatments. Normal levels of chromium in blood is 4.9 to 9.5 nanograms per milliliter, and in hair more than 500 nanograms per gram. Some evidence shows that taking chromium picolinate can lower fasting blood sugar, low insulin levels, and help insulin work in people with type 2 diabetes. Also, chromium picolinate might decrease weight gain and fat accumulation in people with type 2 diabetes who are taking a class of anti-diabetic medications called sulfonylureas. Study with 180 patients with type 2 diabetes demonstrated that supplemental chromium had significant beneficial effects on glycosidated hemoglobin, glucose, insulin, and cholesterol variables in subjects with type 2 diabetes. The beneficial effects of chromium in individuals with diabetes were observed at levels higher than the upper limit of the estimated safe and adequate daily dietary intake. I've read an interesting clinical case described in the Journal of Clinical Nutrition. A 40-year-old woman who has been on parenteral nutrition, including glucose infusion, for more than 5 years develops neuropathy, impaired glucose tolerance, and a drop in plasma-free fatty acids and plasma leucine. She was injected with insulin to maintain normal blood sugar. Then the insulin administration was stopped and 250 micrograms of chromium was added to her parenteral nutrition daily for 2 weeks. For the next 5 months, she didn't need insulin, and her nerve conduction and well-being returned to normal. In 2002, the same journal published a meta-analysis summarizing data on 680 participants from the 15 randomized clinical trials, RCTs. Data from RCTs show no effect of chromium on glucose or insulin concentrations in non-diabetic subjects. The data for persons with diabetes are inconclusive. In 2003, authors of another meta-analysis concluded that chromium lowers fasting blood sugar, but does not affect glycated hemoglobin, lipids, and body mass index. Scientists from Indiana, USA, showed that chromium enhances insulin action and glucose transport at the molecular level and could be beneficial in individuals with glucose intolerance, type 2 diabetes, gestational diabetes, and steroid-induced insulin-induced diabetes. The effectiveness of chromium is influenced by insulin therapy and blood cholesterol levels. Chromium has no effect on glucose control in healthy subjects. At the same time, chromium may selectively enhance the ability of insulin to stimulate glucose transport in cells rendered insulin resistant because of increased plasma membrane cholesterol. These findings at the level of the cell are consistent with in vivo observation that chromium supplementation improved glucose tolerance and decreased circulating cholesterol levels. Vanadium. Vanadium is the only natural metal that is present in trace amounts in all tissues of the body. It was named for the Norse goddess of beauty, Vanadis or Vanadis, because of its beautiful colors. Although most foods contain low concentrations of vanadium, less than 1 nanogram per gram, food is the major source of exposure to vanadium for the general population. Vanadium is used for treating diabetes, high blood sugar, high cholesterol, heart disease, tuberculosis, syphilis, a form of tired blood, anemia and water retention, edema, for improving athletic performance in weight training, and for preventing cancer. Normal concentrations in blood are 1 nanomole per liter and in urine 10 nanomole per liter. Israel scientists report that the vanadium ligand potentiates the capacity of free vanadium ions to activate glucose uptake and glucose metabolism in red adipocytes in vitro by 4 to 5-fold and to lower blood glucose levels in hypoglycemic rats in vivo by 5 to 7-fold. Moreover, they observed that chelated vanadium compounds are more potent than the free metal oxide in facilitating the metabolic actions of insulin. And scientists have established such a compound with high synergistic activity in reducing blood glucose levels, with low toxicity and good solubility in a neutral aqueous medium after complexation with vanadium. This is the L-isomer of glutamic acid gamma monohydroxamate. Unfortunately, clinical trials on the effects of vanadium on patients are few and far between. The study with 40 patients suggested that high-dose vanadium might lower blood sugar in people with type 2 diabetes. Another study with 6 patients indicated that 3 weeks of treatment with vanadyl sulfate improves hepatic and peripheral insulin sensitivity in insulin-resistant, non-insulin dependent diabetes mellitus humans. These effects were sustained for up to 2 weeks after discontinuation of vanadyl sulfate. Several studies have shown that vanadyl sulfate can lower elevated blood glucose, cholesterol and triglycerides in a variety of diabetic models, but it's not well observed. Some safety concerns are associated with toxic side effects of inorganic vanadium salts such as gastrointestinal discomfort and decreased body weight gain. For some people, this will be a desirable side effect though. More recently, it was shown that organic vanadium compounds were much safer than inorganic vanadium salts and did not cause any gastrointestinal discomfort, hepatic or renal toxicity. So scientists have synthesized and tested a number of organic vanadium compounds. One of these, bis-maltolato oxyvanadium 4, is 2-3 times more potent than vanadyl sulfate and has shown less toxicity. In addition, BMOV could possibly protect against diabetic cardiomyopathy by counteracting reactive oxygen species and endoplasmatic reticulum stress. Doses. The recommended daily intake of vanadium is 10 to 25 micrograms. Supplementation of diabetic patients with vanadium salts in doses from 25 to 100 milligrams of vanadium daily for up to 6 weeks elicits partial normalization of glucose metabolic irregularities. Also, chromium supplements, especially chromium picolinate in amounts of 400 to 1000 micrograms per day, ameliorate glucose metabolic abnormalities in some patients with insulin resistance or type 2 diabetes. The doses of supplemental vanadium far exceed the apparent human vanadium requirement, 10 micrograms per day, whereas the levels of chromium supplementation surpass the safe and adequate intake level for chromium, 50 to 200 micrograms per day. Diabetes mellitus is a serious chronic disease, and the treatment must be prescribed by your doctor. With diabetes, not only an increase in glucose is dangerous, but also hypoglycemia. Therefore, don't combine different hypoglycemic drugs other than as prescribed by your doctor. Take care of your body, mind, insulin, and glucose levels. Bye.